Hi Jacob, I see that you hit your call. Is there something that I could help you with?
Yes, I was wondering if you can explain to me what Diltiazem is. The doctor prescribed it to me but didn't explain it well.
Of course. Diltiazem is the generic name, but you might be familiar with some of the trade names such as Karch, Tiltac, or Diltiazem. The difference is just that the trade names have the active components of Diltiazem, but they're sold under different companies. Diltiazem falls under the category of a calcium channel blocker, which is a class 4 antiarrhythmic agent.
I don't know what that means.
Yeah, so your heart beats in rhythms, but sometimes these rhythms can be dangerous. For example, you came in with a supraventricular tachycardia, also known as SVT, which means that your heart is beating too fast. You have two ventricles, which are chambers that the blood goes into, and when it's pumping too fast, it can cause high blood pressure, chest pain, and palpitations. So these calcium channel blockers help correct the arrhythmia and restore a normal heart rhythm for you.
Why is a calcium channel blocker used rather than another class?
So the heart relies on electrical impulses to make the heart beat, and something that's required for this are calcium ions. So a calcium channel blocker reduces the amount of calcium ions that go into cardiac cells, and this in turn reduces heart rate, decreases blood pressure because it will allow your blood vessels to dilate, which widens and allows for more blood flow. And it will also take care of that chest pain that you're experiencing.
How should I take Diltiazem?
So you'll want to take the medication at the same time every day. Just be consistent with that. And since the doctor has prescribed you to take it 2 times daily, you can space out these doses by 8 hours. When you take the medication, you could take it with or without food. You can use a full glass of water to take the medication. Do not crush or chew the medication. And if you miss a dose, don't double up on the next dose.
How long will each dose be effective?
The onset for the medication is 30 to 60 minutes, and the peak is about 2 to 3 hours. The duration that this medication will last is anywhere from 6 to 8 hours. That's why dosing out your medications from 8 hours apart is recommended.
Are there any adverse effects that I should be aware of?
So due to the vasodilation effects of Diltiazem, you can experience lightheadedness, dizziness, nausea, headaches. There can also be fluid accumulation called edema in your legs. And you can experience an AV block, which is when the heart beats too slowly. And since the medication's metabolize in your liver, you can experience liver injury as well.
That sounds like a lot of adverse effects. When should I call my doctor when I'm experiencing adverse reactions?
So knowing your body and knowing when something doesn't feel right is always a good indication to reach out to your doctor. If you're experiencing high blood pressure or high heart rate that's above your normal range, then it's also a good indication to reach out to your doctor. If you're experiencing prolonged adverse reactions or you have dosing questions, also reach out to your doctor. But if you're experiencing breathing difficulties and chest pain, call 911.
Wow, thank you for the help, Tyler. Where did you find this useful information?
I learned it from Karch's Focus on Nursing Pharmacology, chapter 45, page 786.